place social workers in healthcare institutions, what are the problems we will face and how we can solve them. Pay designation, full-time versus part-time training. So yes, we can place social workers in healthcare institutions because it is highly beneficial. So they play a crucial role in addressing the psychosocial needs of patients, improving patient outcomes, and reducing the burden of medical staff by handling complex and social emotional issues. So let's talk about what are the problems we will face and solution for integrating social workers into healthcare institutions. So first one is designation and role clarity. So unclear job titles and roles can create confusion about the social workers' responsibility within the healthcare teams. So for the solutions, we can clearly define the roles and titles such as medical social workers, healthcare social workers, clinical social workers. So ensure those roles are outlined in job descriptions. So, and as for the job scope, it includes specific responsibilities such as discharge planning, patient counseling, and community resource coordinating, conduct role orientation sessions to educate healthcare staff about the social workers combinations. So the second problem is employment state, that means full-time or the part-time. So determine whether the employee social workers on a full-time or part-time basis can impact social service qualities and availability. So we can implement full-time for the preferring larger institutions like hospitals where patient need as concern and allowing ongoing support and relationship building. So as for the part-time, is suitable for smaller facilities like specialized unit where demand fluctuation offers flexible schedule to attractive qualified professional while managing costs. And also we can use hybrid models, employment commission of full-time and part-time social worker based on department needs such as critical care or outpatient care. So the third problem is pay and compensation. So comparative salaries are necessarily to attract and retain skilled social workers, but budget constraints in healthcare institutions can be a challenge. So as for the solutions, we can give comparative salaries. That means benchmark against industry standard to medical social workers, consider pay scales that reflect experience, qualification and responsibilities. And also additional benefits can be given by the offering attractive packages, healthcare insurance, allowance, and also including health benefit, professional development opportunities, and support for license renewal. So I will invite to Amraj Saya to continue the presentation.
Okay, let's move on about related to the training concept, how we connect the social workers in the healthcare institutions. Before that, I will give an example. I was working in an intensive SEO Sri Lanka as an IT company. They are developer concept. After the A-level, they are taking a 6-month module training, and after that they are giving a 6-month job and including a 1 year. After that they are offering a 6 years contract. That means they are giving a scholarship for us. They are paying for the degree and they are giving 3 years job. Like that, because they are giving the training and the on-job training and everything, they are developing workers with their own, what the company needs. That the HCL, what are the procedures they are having, what are the process they are doing. They are creating their workers their own self, because some education systems are different. There's that company's concept. Like that, we are also trying to develop a training module. What the health institutions needed as a social workers, how can we combine with the health institutions? And also we already mentioned here some names, the medical social worker, healthcare social worker, clinical social worker, and some others have a psychological social worker, and so on cycle. We already combined work with the health institutes also. Based on that, now we are in our modern digital world. If we are doing a digital world, we are trying to initiate a digitalization. All the we can work with remotely also, because the full time the hospital is working 24 by 7, 24 hours working the whole days. Based on that, we can't work as a 2 or 3 clinical social worker or someone whole day. Like that, we are connecting our remotely. We can connect with those people who are in need. Like I got the example, Shanti Markham organization, there is a hotline numbers and there's a Power app that's introduced last week. There's a new app. If they need any counseling and consultation, any need to share your issues and find any your opinions or ideas, you can share it remotely or the phone or through the apps. Like that, if you need any, we can connect it. Like for example, one client you need to meet, but you are not available at the moment, they can connect with you remotely and they can get their opinions, what are these, we can give some counseling sessions and those things like that, we can connect with them. These are the our training modules and those things, and also we can the integration into the healthcare team, we can get their other hospital staffs as well, like nurses and some and the staffs as well and administration, those things we can get their intake and we can give the trainings for those team also. Then we can get those care team supports as well. Founding the resources and allocations, because we have lack of resources, we need to prioritize our needs and needs. Based on that, we need to identify what are the resources we have. Based on what are the resolved issues and problems. Based on that, we are doing some interventions related to that, and we will find out the resources and how can we manage those lack of resources based on our trainings. Thank you.
So thank you very much. I think that was very interesting and very comprehensive. Of course, we should also, for practical purposes, we must also think of not having a new designation. Because the moment you want to have a new designation, it has to go to the Carter Commission, it has to be approved by the Treasury, and you have to go and justify with the Treasury that you are producing a new category. And then you have to place this new category according to the administrative circulars and look at the salary structure. You make it that you won't go there. So I think that can be the next stage when it develops. When we first, I think the important thing is to get the social workers into the health sector. Later on, phase 2 is where you start having medical social workers or healthcare social workers or whoever, specially trained, special degree courses and a professional development. So please think of that other category also. Thank you.
Just to add into that, sir, so we are now actually getting social work undergraduates to the setup where I work. So I used to get social work students to work with me during their training period. So where the NISP has started sending over about more than 12 years, they are sending students to me to do casework and group work. So that's where you can informally start giving the opportunity for the student social work to embark in this field, and gradually they can, when they pursue their higher education, maybe postgraduate even, they can join, and they can itself think of what are the areas that they can develop and link up with the healthcare sector. So shall we move on to the next question?
So good morning, doctor, and everyone. I think this is a good opportunity for me also to address this issue. Sir wanted to understand about how can a social worker help the patient in healthcare institution. I am a professional social worker. Before 10 years back, I specialize in counseling and currently working as a psychologist in private sector. I have many barriers if I address this forum is big, not enough. So we were discussing how we can accommodate a social worker in the school, hospital setting. Ms. Rasika also started to tell we were getting a lot of intern students in every hospital, but they after the program they leave the hospital. So we, as a criteria, we would suggest at least one social worker can accommodate in the hospital. In future, we can think about each and every department, like each and every ward, they can accommodate one. And also in our system, professional program, we have elective subjects like counseling, poverty alleviation, psychiatry, social work, like that. So we are getting specialized areas also. So we believe there is no barrier. A social worker can support the patients, and also in our educator role we can play. Then also we can play many roles as a social worker. Now currently I am working with some community medicine doctors. They always tell we give a lot of medicine, but it's not working. Ahmad, you just call them and see what made them this problem. So community medicine people always welcome social workers and counselors to join hands with them, and that would be a productive management, I believe. So in our idea criteria like that, and refer this educator part, we believe that awareness on each and every community non-communicable diseases, sometimes these people who doesn't want to reveal their health problems, so they go for different traditional medicine method. So we as social workers, we can get joined together with the Gramaninadari or any other MOH system. We can go and educate the patient or the public. We have this kind of facilities in the hospital. Why don't you go and take medication and all? So like that. So there are a lot of awareness program we can do. If the system included us, I believe our professional knowledge would support the country. Why don't you join the networking?
Thank you, Speaker. According to our discussion, we discussed the prevailing situation in Sri Lanka. Within our discussion, we identified need of having the intercollaborative practice in health sector, especially within the classroom. We are teaching that as a practice method of social work intercollaborative practice, the ways and means to apply with the intercollaborative practice. But the health sector is the very required and needed place that having the intercollaborative practice, which it means that the collaborating with that the each professionals aiming at the each cases. So our suggestion is that in Sri Lanka scenario, that in the academic programs, especially in NIST, we are teaching that kind of methods, but the applicability is that is not happening in a proper manner. So we are suggesting to having that kind of mechanisms. As well as we, as a social worker, we can contribute to betterment of the patient, that having in the inclusion of the patients. According to the Sri Lanka scenario, some of the, especially as an example, that the mentally ill people, there are so many that kind of patients in the society, but they are not networking that the service providing sector, especially that the hospital settings. So social worker can contribute them to include that kind of services in the country. So, I invite this.
Thank you very much. I am going to talk on the social stigma in the society. It's a big issue in our society. Because of the social stigma, normally the patients, some illnesses like AIDS and cancer, and even the people who are having diabetes, they don't like to reveal that they are having that so-called illness. So because of that reason, they are not taking medicine. So as the social workers, I think we have to promote them to go to the doctors, particular consultants to meet and taking medicine. So because of that reason, I think social work should be there, and that networking also should be there. And regarding this lobby, demand of social workers, and the social worker has to do the lobbying part also, and at the same time, empowering the patients also, social worker can do. Because of that reasons, I think there's social worker has to do a role of advocate also to make awareness of available resources, because resources are there and our clients are there. So we have to link those resources with the clients. So because of that reason, I think social workers' role is very prominent and imminent. So my colleague will talk on the rest of the others.
To address this attitudes of the professional is a big barrier for all the problem. One of my colleague who is belong to community medicine, he was asking who is biggest resistant for your profession. I was thinking resistant, they talk resistant, who? Psychiatrist. Like that he was kidding. No sir, what I want to tell, lot of years, many years people take medicine. Finally, they also don't know why they are taking medicine, what caused them to go for this psychiatric medication and all. Then once we take all the records and check, this is a history. Because of a divorce, last 10 years taking medicine. If we could attend the divorce part properly before 10 years, I don't know whether I am correct or wrong. Like that, many simple domestic violence, maybe a behavior issue, maybe an ADHD issue, sending them to medication, finally they will end up in conduct problem, many other psychological issues. So professionals, all the professionals are equally treated, equally seen by all the other profession. So we should respect the profession. I hope social work is not a barrier to any profession. I was guiding my juniors, don't worry, after 10 years you will be end up in a professional place. So we have very motivated way of encouraging people. Also we also motivated from our senior social workers. We believe we can do a lot of works as a team, sir.
Can I add something? I think as a social worker, we want to research about what is going on there. So as a patient, maybe patient rights and everything, we should include this thing. And the other thing, we have a role in the education part. I think maybe other sector, we have what is the mental health, what is the illness and other things. Because of all are concerned about the illness. But in our team, we concerned about the part of mental health. So everyone have a mental health. So other thing, as a social worker, rehabilitation part also one of part in there. So when we have a client, he have a lot of barriers. So we can recover the treated in hospital, doctors describe the drugs and other thing, we have to rehabilitate the client. So that's the one thing we can do. And thank you.
We suggest our research department to give some topics on this area. Correct? They can take some topics why in the hospital system and social workers are not getting done. Okay,
Thank you very much. I think one important point you made was about linking with the community. So we have a very extensive MOH system. You all know that started in 1926 with the overseas experts here. From there on, we have a preventive sector which is with a MOH. And MOH is in charge of a population of people. And so that's one place where social workers can be linked. And the Ministry of Health is starting a new primary care system in the country. So that will be also like the MOH, the preventive sector. So that will be another area where you can get, you can link up with. I am a bit concerned with this term client. I think it is used, the term client, but immediately when you use client, you are bringing in business. And I am a bit uncomfortable. I am uncomfortable because Sri Lanka, we are not using this term client. It could be a person or another human being. So think of it.
The word beneficial is even worse.
Not beneficial. You can think of a neutral word. I mean, think of a word which doesn't really stigmatize just a person. Now we are talking of person-centered healthcare also, which shifts.
Service user.
No, even again, if you become, you try to give a boundary, like you are a user, we are a user, kind of.
Yeah, in the hospital they use patients, which is not very good. That's another label.
Just think about it. Give it a heart.
Seva. Yeah, but think of it. You know, these words get loaded, and after some time they become client.
No, I don't want to take this much, but so we always say that we work for humans and human well-being. So to work with everyone's well-being, we can call it as we work for humans, the person's content. So it's person-centralized care. Whatever the care we provide, socially, medically, psychology, it's ultimately end up with the person-centered care. So I think it's the best word to use the person, as person who you are. So I think it's something to think for everyone. Okay, right. So shall we go with the third question?
Good afternoon to all of you. So our team, we basically discuss, we try to make an attempt to answer the question, it's on how can social workers partner with healthcare workers. So basically in our team, we try to make an attempt to identify from grassroots level and also from kind of an institution level also. So first thing that we discuss is shift basis, that is called GMO model. So it is basically link healthcare workers and social workers. So one of our team members is going to describe that to you.
I am also a social worker. I have experience as a mediator. So I have done many things. Here there is a basis by shift basis. Now the good model is judicial medical officer versus in-house doctor. See how the judicial medical officer is seated in separate area, the judicial office, and the in-house doctor only treating the patients in the hospital. Now it is referred by a printed form, checklist. With that, immediately the JMO come and examine and go. So similarly, the specialist is JMO who advise more to the in-house doctor. There's a fracture, you have to treat the patient like this. So there is a link. Similarly, the simple is simple printed form. No need a big tedious form, because paperwork will be more paperwork. We have to reduce the paperwork. So that is a simple checklist. The social worker will come, on the shift basis is available in his department, because he should be access to all the wards, not to the just establish a desk or office like a police. So he will come. Definitely he have a link with at that time with that healthcare worker. So healthcare worker knows this patient is accident or he got assaulted. Details are known, so they will be very caring that person, because normal patients no need that kind of care. So you can utilize that social worker to all the wards, because social workers are very rare. So this system is working in Sri Lanka very well. The judicial medical officers part with the in-house doctor. The in-house doctor is only treating the patient. So he knows very well about the because in that file record of the patient, judicial medical officer has given a very good recommendation. This patient has gone this accident, fracture, that one. He need 5 days like that, because in-house doctor won't be knowing that. He will just to check out the patient within 2 days. He will try to. So there is a very good that model can be used for the healthcare workers, and I think that is already that model is there. Thank you. And my team other points will be discussed. But I only elaborated the first point.
Right, thank you. Then the second point that our team identified is actually self-help approach. So it is actually based on the grassroots level, and one of our team members is going to describe that model to you.
Thank you. The SHA model or self-help approach, I'm sure Professor here will definitely identify with this model, because it's more like the Grameen model. But in this situation, actually, currently, there are several places where this model is used. One is SERV. I think we have 2 people from SERV who's already using this. And it's a more holistic model, not just healthcare oriented, but this can be very well adopted to health as well. It starts with the self-help groups at the ground level, and the self-help groups are trained and they're very capacity building oriented, because that each person will have to go through the training in groups, and these are neighborhood groups, so that it's very easy for them to meet. At that level, not only that they meet together, but they also identify what the issues of that particular neighborhood group is. Whether one is sick, whether another person is lonely, another person is poor, cannot afford anything. All those issues are identified at that level. And also the application of social work, actually, the whole structure is there, because we try to develop individuals by giving rotational leadership to each person. So each person is developed, so it's like really social work, group work in social work, where we do group work, and at the same time we develop individual capacity of the person. So that person has the confidence built by the time they go through the whole the training. Then of course, when we develop 10 such groups with 20 each roughly, but probably we may not get 20 all the time, it can be 15, it can be 20. So at that level, as I said, it's not only health, but health can be applied very well here. We will ask one of the SERV people to give us as an example later. Here, they also identify or rather they save. They make their own saving at this level. So they have a collective pot of collecting money. So they know individually how much they are collecting, as well as a group how much they are collecting, and it's all administered at that level. So if I want a loan to raise a few chicken, then I have access to this money, so that I can borrow that money from the group and I can pay back with a little interest, so the money grows. So like that, when we have an issue, even if it is medication, at least here we are developing the individual economic capacity where they can also look after their economic requirements for medication or whatever they have. Okay, so therefore this is very holistic in that sense. Then once when 10 such groups are formed, so there will be so many tens of here, then 10 groups will form one cluster. 2 people from each several groups will form a cluster level association where there will be 2 representatives from each of these. And the role at this level is to build capacity, continued building capacity of this group. So whatever the may be, whatever the issue may be, and this is where we can include health very well. Because one person can be trained to look at the health issues, and that person will build the capacity here in terms of health. Like even environmental health, the nutritional requirements or whatever, and their psychosocial well-being at the group level. Then from here, once when 10 such groups are made, then they become automatically qualified to form a federation. So that is the more, the whole network is here, and they have a capacity for advocacy with the local government authorities or whatever, and so therefore this is the numbers forming, giving an advocacy role to the federation level. And in order to make the whole approach of social work more effective and efficient, it's a social worker who really facilitated the whole process. So therefore, one social worker can do so much in order to mobilize at least 2,000 people, and so if they can talk about how they came up with this. Now at this level, the MOH, this represents certain MOH areas, so therefore they went and advocated to the, can you explain that? So it's easy so that we have practical experience.
I'm actually one of advisors for this organization, and it is like this because at the community level and these self-help groups, they know what to do and how to tackle their health problems and the other related social issues. And also they are very connected with the divisional secretary office, and there are counselors and other officers who are working with children and women. And therefore these officers also go to the relevant communities and help these community members, and also they also support to develop their health programs, sometimes health issues and economic problems, and they are actually sustainable. And that network actually very, very successful in Molatua and Pandura areas, and therefore it's a kind of like very good model we can apply to other areas. And we are talking about health issues, and here actually they get basic knowledge about health problems. And also this organization providing all kind of like awareness programs, as well as health officers go and help them and conduct like whatever camps and also different kind of programs going on to help these people in communities. Thank you. I think Annie is okay.
Thank you. One such cluster, they even set up a clinic in the community so that the MOH can go and provide the necessary care to the children. So they link with the family health officer and the MOH at that level. Yeah, I think.
Thank you very much. Thank you very much. I think so that's very interesting how they approach the problem from a community perspective. But we also must think of the hospital sector. We are going to, because that's one place where you get people who have acute illnesses, catastrophic, and they need help. And so we have to think of both. One is at the community level and at the hospital levels also. So from the MOH point of view, I think it's very important to have these linkages, and I think it's a very good way of looking at it. So I think those are the main things. Of course, the other area which there's a lot of research also on the social determinants of health, which is coming in, and how social workers can be engaged with communities to explain and make people aware of social determinants of health. And that's an area which is not, we try to cover it in the medical school also, but doctors tend to be more biomedical and forget the social determinants. The community physicians, yes, the MOHs, they will, that's why they have these inspections and so on. But on a broader note also, we have to think of social determinants. I mean, things like air pollution, stigmatization, ethnic disharmony, all those are determined by climate change. Those are all determined by social relationships and social structures, and we have to deal with those.
Doctor, I would like to add breastfeeding rights of women also. Women and breastfeeding.
Breastfeeding rights, yes. Because I mean the advertising agents, advertising of supplements and how they influence the healthcare profession, all those are important. You will come across these. You will come across these.
I have come across some cases like after delivering, after the baby delivery, doctors they evaluate the depression level, and they are going for postpartum or this kind of depression issue. I don't know how they are managing these cases. Is there any methodology after evaluating the depression level?
Yeah, the psychiatrist, I mean, if they come under the
That is in MOH.
Yeah, MOH, ideally they should be referred to the psychiatry if there is depression to that level and followed up. They are increasingly recognizing maternal and postpartum depression, and even recently there was I think they had a symposium on maternal depression, because it's hidden and you miss it. A lot of people miss at the community level. You feel it's just that the wife is withdrawn or getting angry, and it's because of the children. But to see they have actually got a problem with their mood.
Professor, it's very happy to hear about your analytic presentations. Anyway, I would like to get some kind of clarification.
In our hospital setting, we have a very good psychiatrist. Is there any difference between psychiatrist and psychologist? So do we have psychologist in the hospital setting? In the government hospital setting, do we have psychologist and psychiatrist? Psychiatrists, I have heard they give only pills. they give only pills. Psychologists, do they have any relaxation kind of and psychological services for all clients? What they have related to you? So do we have enough personnel to cater these issues? That is my worrying factor.
I'm sure there are others who will answer this, but basically psychologists do not use medicines. And it's normal functioning, and when there are some disorders, you call it clinical psychology, and then you are pretty close to what the psychiatrists are doing. But drug prescriptions and so on are by the psychiatrists, and the psychiatrists would extend from very minimal minor disorders like anxiety or certain contextual issues to the hardcore psychiatry, which really involves schizophrenia and severe depression and so on. To answer your question about psychologists, no, we don't have enough psychologists. Of course, we have a whole informal structure of care in this country. It is the informal structures which we have in the family settings and relatives and so on. Now, I'm going to tell you something very controversial, because the psychologists, we learn psychology from the Western mind. We are imposing a Western mindset on the Eastern mind. Eastern mind is different. Eastern mind is not individual based, it's networked. We are involved with our families much more. We share things. Our autonomy is shared. When something happens, the whole family is involved in that. And in fact, there are books which have been written whether we are being even a Western psychology is making us as mad as the West. This was seen after this tsunami, because after the first tsunami, we had a second tsunami of people coming in search of post-traumatic stress disorder, and they didn't find it. So there is an issue there. We need locally relevant psychology, and we should be looking at the local self. Our concept of self, of a person, is different from the concept of a self in the West. So we should be bringing in those, our psychology courses. Now the problem is we are having a whole proliferation of psychology courses which are from foreign universities. And they are giving us the Western model. And that might not work as effectively. So that's the thing about psychology. But the same goes to medicine, to psychiatry. We are colonized. We try to.
Thank you very much, sir. With that enlightening thought, we are going to end the session today. So I'm handing over the mic to Chatu.
Thank you very much. Thank you, Professor Saroj Singh from the Faculty of Medicine, University of Colombo, for your excellent presentation that you delivered, with making some rich questioning barriers. And once again, I'm thanking for your contribution and the insight that you made towards social work. With that note, I would like to invite you to come forward to receive a token of appreciation from the Association of Professional Social Workers. And for that, I would like to invite Mr. Mandali to come and volunteer. lunch. So lunch is served at ground floor.